Hello, and welcome to another edition of the SEANC View Podcast. I'm your host, Jonathan Owens, the Communications Director here at SEANC. Joined, as always, by the Executive Director, Artis Watkins.
Hey, John.
The Government Relations Director, Suzanne Beasley.
Hi.
And podcast producer extraordinaire, Sam Klein.
Woohoo.
Listen, we got a lot to get into about the state health plan this week, so let's jump right into it. So today is August 21st. September is the beginning of fall, right? So it's not.
We talked about this in the summer.
22nd is the official
Okay.
like the
first
end
day.
So we're still in summer.
Sam always knows these things.
You know, when kids start going back to
That's
school and
'cause
everything.
That's when Libra season also starts.
Goodness.
Okay.
There you have it.
When the kids start going back to school, you start thinking fall.
Yeah,
There's football
you do.
practice going on.
To
like-
me, it's when we walk out of convention.
Oh,
Mm.
you're right.
At
Yeah.
the end of that first week of September, the air
Yeah.
always feels different already to me.
It does.
Mhm.
There was one year it was like hot when we walked into that building. A week later, like we don't leave that building for a
Like,
whole
right.
week.
Yeah.
Yeah.
I think
And
that's
it was-
part of it.
Yeah, and it was kind of cold when we walked
Yeah,
out. and
I
was like,
remember that.
Okay.
Refreshing after all of that.
Yeah.
So speaking of that will be going on in 2 weeks. We hope to have some cool things lined up that week for our podcast. Fingers crossed. Last year we tried and failed to get some
we
cool
just
things
thought we'd
going,
find some time there to record
but
things.
we did
Yeah.
not.
But we're going to make it happen. Sam's bringing the stuff again.
Yes.
We're going to figure it out this
Because
time.
we have some
mean-
very interesting things from members that I think the public would be
Yeah.
fascinated to hear about their public service and how it affects the public when the public may not know it.
I kind of want to do like some impromptu man on the street type interviews
Yeah,
too.
do it.
Yeah, I
with
love
some
those.
Folks.
Mm-hmm.
Folks have been going to that convention for 70 years, just some of
Yeah.
those.
There's a lot of experience.
Lots of great
and-
stories out there.
yeah,
So
yeah.
stay tuned for that. But speaking of podcasts, Artists, I heard that you cheated on us this week. You did
I
commit
did.
some adultery. Tell us
Oh.
what happened.
Is there podcast
Whoa.
We're
adultery?
going to get you a Scarlet A to wear.
Yeah, I did. With New Frame, they have a podcast, Do Politics Better. And I think it's the most popular political podcast
It's really
in the
good.
state.
Yeah.
And I'm a fangirl of it. They know it. So I think they took pity on me and had me as a guest for that. But no, I take that back. They had me as a guest because SEANC
Is awesome.
is awesome and interesting. And I am lucky enough to be the executive director. So I got to go on the podcast. And it was really good questions. They cover so much ground. They're very good at what they do. And they talked about our podcast
Okay.
there towards the end. They're very complimentary
Right.
of the work y'all are doing. So thank y'all.
They were like, who's that redneck guy you got?
Lord, I am
I can't
surprised they
understand
didn't
him most of
say
the
there's
time.
something about Sanford.
I feel like there is a possibility that I could make a whole podcast episode of you talking about how much you love Do Politics Better.
You probably
Yeah.
could. It's embarrassing. But yeah, so
There wasn't the top 5 on that list that we were talking.
something insane. We moved up on that list.
We're up.
Woo.
We overtook the Top Soul Insider.
We overtook a bunch of people.
Oh, wow.
We're up to like 66 now.
Mhm.
Ooh, y'all were in the big time.
Whew.
Yeah, moving
that's
on
right.
up.
That puts more
George and
pressure
Weezy.
on me.
It does, Sam.
Well, this week's topic du jour, I think I'm using that word right, is the state health plan with the announcement of the increases in premiums for next year that came out on Friday
Friday,
after
yeah.
their Board of Trustees meeting. You probably read about that in our weekly scoop email that goes out. And it looks like increases are $25 to up to like $110 a month for some.
Yeah, since
members.
it's going to be based on tiers, so it's going to be based on your salary. After conversation, we've learned that you won't technically know exactly what that amount is until open enrollment in October.
Mhm.
Our members don't like that.
No, they don't.
And we talked to Tom Friedman about it in a minute, but it's class warfare
Yeah.
among state employees when there's 41% raises being given to people running hospitals in this state, doing business with the health plan, and so far, they're scot-free. They haven't had to put any skin in the game, and yet we've got state employees fighting over who makes more when they all make way less than they would in the private sector.
Plus,
So,
no pay raise coming
and
that
pay
That we know
raises,
of yet.
we know of.
pay raises that have been under that of the private sector forever.
Yeah, they're so far behind that they go in the hole.
Yeah,
They
the
go
whole
in the
thing
hole.
about the state health plan has been that it's a benefit
Mhm.
and that if you pay less than the private sector, you try to provide better benefits to make things even out for employees. And we just can't say that anymore.
Yeah. So, as you mentioned, we do have Executive Administrator Thomas Friedman on this episode. You'll hear from him in a few minutes. He was nice enough to come back, maybe our first non-member return guest
He
to
is.
the podcast. So he said we were exclusive for him.
Yeah, we were his first
Yeah.
and only podcast.
I'm not
at this
exclusive
time.
with this podcast, so
Yeah, really.
Clearly.
Yeah.
but he is.
He's more loyal
Thank
than
you,
you are.
Thomas.
No, but we really appreciate him coming back and facing the fire, especially after this topic, because it has drawn a lot of criticism and comments on our
lots of
social media
reaction.
and Facebook page.
And as a matter of fact, when you guys listen to this, some of the questions that we asked of Thomas are directly from you. They're questions we pulled from your social media contacts and from phone calls, conversations we had out in the field. So be sure to listen.
Yes, stay tuned. And then after you listen to our podcast, we will allow you to go listen to artists on the
Do Politics Better. Thank you again.
So like you were saying about the benefit, that it is a benefit. Like, I've heard a lot of people say, well, everyone's premiums are going up. Why would state employees be any different? Like this just makes, and I think it seems like that's kind of the logical conclusion that Treasurer Briner reached, that everyone's premium is going up. But it's a benefit to entice people to be state employees and earn less.
There's two things about that. Number one, okay, if you want to treat us like everyone, then let's get raises that are at least average with what the private sector gets every year. We're not. We're under that. So people want us to be like everyone else when it's not to our members' benefit.
Mm-hmm.
But they don't want us to be like everyone else if it means it costs money. And you simply can't have it both ways and retain employees. And that's why we've got an over 20% vacancy rate in state government. People don't want to come work for state government. And then you have taxpayers complaining because of poor service. Of course, you're getting poor service. You're getting, at this point, people coming into state government are many times not at all what used to come into state government.
Yeah. So like a lower cost, stable state health plan is part of a broader package to entice people to work.
You had a good health plan, a good retirement plan, which has been, the retirement plan's been changed a lot too. You used to be able to count on COLAs. The cost of living adjustments if you were a retiree. That's not anything anybody's been able to count on in years, decades. And you don't have health care when you retire anymore. That got taken away a few years ago.
Yeah.
And so those things used to be huge benefits. And then finally, the stability of state government. That's gone too, because now everybody wants to cut state government.
And then they want to take you off the SHRA protections and take even more protections.
Yeah, so you're going to have people coming here to work for just a very short time, not care if they're doing a great job. That's not what the taxpayers deserve or want.
Yeah.
So,
and just as an aside, you would think someone like Briner, who is coming from the private sector and probably made lots more money than he does as treasurer, and
well, I think he deeply
that.
appreciates his state employees he deals with. And I'm sure he appreciates state employees generally. He's up against it. Let's face it.
Yeah.
He is up against, as we call it, or I called it, Goliath. The healthcare industry controls everything.
Yeah.
All right. And they're hand in hand with private equity more and more these days. Private equity is buying more healthcare. Healthcare is buying everything. Little league teams, stadiums, the naming rights of stadiums. Healthcare is everywhere. They're the biggest sponsor of most media. So what kind of coverage are you going to get when you're doing a story saying, hey, we're paying these healthcare providers too much? It's not going to doctors and nurses. It's going to deep, deep levels of admin and executives at these hospitals.
So we're getting 41% raises.
Getting 41% raises according to them. So that's problematic, but that's what Briner's up against.
Mm-hmm.
So I'm sure this first year, his head's got to be swimming. What do I do with this? He sees it very much as a problem he inherited from Treasurer Falwell. And look, Treasurer Falwell tried to do something about this by saying, as a state, we should put a cap on what we're going to pay folks.
Right.
We shouldn't overpay folks by 4 times what it takes to make a profit. The legislature at that time was not open to that. They gave him grief for days. And of course they did. Healthcare owns everything here in North Carolina.
And
It's a
we're the most expensive state in the nation.
Yeah.
The most expensive in the country with the worst outcome.
Yeah, it'd be different
Health-wise,
if we were ranking really high on outcomes, and we're not. So patients aren't doing better here; they're doing worse, but they're paying more for that
Right.
privilege.
Well, I think that's a good backdrop to launch our interview with Thomas. I think that was a good primer for it. So let's turn to our recorded interview with Thomas Friedman, and we'll return afterwards for a few parting thoughts. Back by popular demand, we have a returning guest to our podcast this week. Thomas Friedman from the State Health Plan, Executive Administrator of the State Health Plan, was gracious enough to return after the announcement on Friday of new premium structure for the plan. Thank you for coming back.
Volunteered to come back.
Yeah.
Thank
Yeah. I'm exclusive with y'all for podcasts.
There you
I
go.
love this.
What did we pay? Do we pay?
Well,
Well,
special.
we thank you so much for coming back and then allowing us to grill you with questions. And with that in mind, I'll turn it over to Suzanne.
Yeah, thanks, John. And Tom, thank you for being here today. I'm just going to plow through some of the questions that we've been getting from our members and just a couple that we have as SEANC.
Can I back it up a
Yes.
second before you even get to these questions
Yes.
from our social media? So we had a number of questions around something that Treasurer Briner said in a video that went to all state employees, just to set the stage for this. And in that video, and we can play a snippet from it here, John, you can insert that.
Simply put, this means starting in 2026, state health plan coverage will be more expensive for many members. But this burden is not only on you. It is also shared with the state, which has invested an additional $100 million in tax dollars next year to offset some of those rising costs. Thank you to our state lawmakers who prioritize this funding in a tight budget year. But also, healthcare providers from Murphy to Manio have stepped up and gotten their costs down for our plan members. That means they are taking less for the same services. This three-pronged approach is the only way we're going to get on track.
That was important. Thank you.
It's okay. So that's where we're starting from, because we had a lot of people saying how much from providers. Now I got it all
based on
figured out.
the treasurer's statement about where we're getting the money recouped and how, it's coming from employees, it's coming from the legislature, and it's coming from providers, just touch on how much we're getting back from providers, what that looks like.
Yeah. So before I jump into that, I want to say, whenever, Jonathan, you splice in like the audio from things, I've never been a part of a podcast before that's done that. So I'm sure Brad sounded great on it from the clip. But so thank you. So I think we're getting money back from providers in two ways. One is short-term and immediate and very, very predictable. And the other one, I think, the good side is we're continually hoping for a bigger number. One, I think y'all remember in our February and March board meeting, we talked about the Clear Pricing Project and how it was budgeted to save a few $100 million and wound up costing $150 million. And the cost was we were paying providers more money. So phase one of recouping money for providers is ending the Clear Pricing Project. So those providers will be getting a rate cut somewhere between 40% of Medicare down to 70% of Medicare, depending on what their base rate with Aetna is today. And that will show up 1/1/26. So we could count on maybe around $100 million and some change there, depending kind of on where members go. The bigger and more exciting kind of pool of money we've been negotiating with providers, and I think the treasurer was really specific on that 8/15 date for a reason. So part of our partnership with Lantern is purchasing an existing network of providers that will be, going from the mid 200% of Medicare to, between 115 and 147-ish, I think is the number. That is kind of the standard Lantern offering. So all of our folks who are using those providers already, somewhere between 100% and maybe a little bit higher cut in rates. What is exciting and unique and kind of specific to what Treasurer Briner was talking about is we're doing something a little bit different on top of that. And this is something I think pretty unique. So providers generally don't compete on prices for things, right? They kind of negotiate in a closed door with health insurance companies and, there's like, well, give me 3%. No, give me 4%. Give me 5%. No, how about 2%? And it just up. And the prices are kept pretty secret from one another. And you guys have been really out in front of the transparent, like the issues with price transparency. So we've asked them to do something different. So Lantern has a good-sized network in place, but we want more procedures, more doctors, more access for state employees. So what we have done is we've broken the state into 6 regions. We're using the Medicaid regions for simplicity's sake, and said, we want to add more services that Lantern does not currently offer with more providers that Lantern doesn't currently offer. But health systems, only one of you are getting it by service line. So we're not going to say the difference, and I'm going to kind of pivot to the difference between this and CPP. CPP, anyone who wanted to participate could come in. And the challenge was that people were making less signed up, and so they got raises, and no one, generally speaking, was making more signed up. That doesn't spur competition, and that's, I think, part of the reason why folks didn't sign up, right? Is because doctors weren't going to get anything for it, right? It was just give us a discount or you're the cartel, and they said no. So where we are saying is if you want more volume from state health plan members, and I think it is the best, most predictable volume in the state, companies leave North Carolina all the time. People switch their TPAs all the time. People switch jobs all the time. Not state employees, not teachers. We are consistent, predictable, reliable public servants, and we continue to be. So in the face of all this uncertainty, these health systems should want nothing more than to take care of state employees. Full stop. I can't say it any plainer. If they are being financially responsible, they should want state employees coming to their facilities. So to that end, we are asking them right now, and the intent to participate was due the day of the board meeting. And I'm happy to say that every single health system in North Carolina agreed to bid and participate to try to drive down the lowest price. So we are negotiating with them right now on rates. So they commit to a initial offer by service line. So, UNC might be our ortho partner in the triangle, but Duke might be the heart partner. And I'm going to circle back to Duke on purpose in a minute. Or we'll say in Charlotte, Novant might do general surgery, but Atrium might do GI services.
So under Lantern,
yes,
all of these systems could be in a different region.
Correct.
So
and
you
that
could have Novant in this region offering services under the Lantern model, and then UNC here in our part of the
That's
state.
right.
Okay.
And I get it's a little tricky, but I think about it this way. It's tricky because they've never been asked to compete before.
Right.
Ever. I think this is a wholly new concept. And it's tricky, and where I get the questions, and I appreciate the question, is this too good to be true? Because we are giving it to the member for free. And that is how we've got them to compete. Because again, if you go to the most predictable group of folks in the state employees show up to work every day. Teachers show up to work every day. Once you retire, you're on the state health plan, you're sticking around on the state health plan for those non-Medicare folks.
Well, you realize it's not too good to be true if you think about how much we've been overpaying.
You are exactly right.
People have asked me, are we? We must be crazy overpaying if we can provide something for free and still do better than we were under existing contracts. That's insane.
But on the other side, too, we have members that I've talked with in this past week who are, you get what you pay for. So if it's going to be zero, are we getting quality care?
Yes. And that is that would be the first question I'd ask. Right. And that is a fair question to ask. It is not every provider at UNC. They are then filtered on by the highest quality providers based on their credentialing, the number of times they've done something, right?
Right.
I think about it as I don't want to be the first person someone does knee surgery on. I want to be the 10,000th person they've done it on. So we're looking at what their readmission rates, the other kind of general quality scores. Where did they go to school? Like, what are their kind of different credentialings of things?
So the vetting process
is robust.
It's not lowest bidder win.
Right.
Quality is the front door.
Right.
So it is the lowest price for the highest quality providers wins.
Yeah.
And I think that's an important distinction.
So we will take a little guff from our listeners for being supportive of this. But we are, because as we've told you in talks together, SEANC, state employees, we can't say no to everything. And this Lantern approach seems to be a good approach to try to bring some competition to things, some actual, in our capitalist society, to actually have some competition in what has been a very, not just secret, but monopolistic almost, industry as it related to the state health plan. So that being said, that's not money right now. That's all conjecture as far as how many people will participate. And then the CPP is not something that was negotiated. People were told you're no longer in the CPP.
Yep.
So I think the issue people are taking is that legislature put in $150 million. The premiums and out-of-pocket expenses are going up on the employees. Those two things are for sure. providers haven't given anything yet.
Well, I would say I'm going to invite you to any of the the provider stakeholder groups I'm going to with like the different associations.
Oh my gosh, please.
when their rates are being, we are hearing loud and clear from them. You are literally taking hundreds of thousands of dollars out of our pocket by ending this program. So those folks.
Oh, no, CPP.
Yeah.
Yeah. No, again, that wasn't negotiated. They were just told.
Yep.
But here's the thing about that, though.
Yeah.
So the CPP was the people that were kind of underpaid. We knew the range was anywhere from just shy, I think, of 90% at one time of Medicare to over 800%. And it was the people in the CPP were the ones who were getting, not even 100% of Medicare reimbursement in many cases. So it was folks who were kind of underpaid, often in rural areas.
I think there's a little bit of that. And I would also say where I bristle a little bit is some of the folks who called me and said, this is ending, is like, you're taking my cash cow away from me.
But think of that, though. If the ones who were so underpaid, it was a cash cow, then how in the world can we pay somebody else 7 times
and we
what they were getting?
And we shouldn't be. That's why we need to
But they're not giving up anything. The 7 times more people aren't giving up anything right now.
I think that what they are going to give up is volume. I think, and so you could set the rate at $1 bajillion or $1. If no one goes there, you don't make any money. And I think that is where we are kind of structuring the incentive. And that's where we need the help of SEANC, NCAE, and every other association is we want folks to go where they are folks that value state employees and value the contribution state employees do with their highest quality providers. So we want people to go to the providers that are providing those lower rates. And they're negotiating hard and strong and giving us a lot for it. So I'm less concerned with the rate of people that no one is going to go to and trying to make it really attractive, really easy to access from the best quality providers, folks that do want to work with us. And if there's a point in time where we have to narrow that network, I think that's a discussion to be had. But for every 20% utilization of our Lantern providers, we literally save hundreds of millions of dollars. So not just does the member save money at the point of care.
Right.
You think about what $200 million would mean in terms of premiums not going up, cost sharing improving, different kind of points of things. So I think of it slightly differently. There are some providers who aren't going to bend on their rates. That is their decision. My decision is to make it so burdensome for our members to get there because those folks aren't trying to help sustain our state employees. They are not worried about the cost and quality of our state employees. So while I can't force anyone to take a lower rate, what I can do is make it so easy for folks to not go to those providers and go to the providers where they are going to save so much money that we can charge it for free. I want to do one analogy here because with one of the most obscene ones we've seen. There's a hospital that charges, I'm not going to name names, 7.5 times more for a colonoscopy than an ASC center in Raleigh. I could go in a limo, pick all the folks up, drive them their colonoscopy, put them up for 3 days at the Umstead, come back and pick them up in the limo and drive them home, and we'd still save thousands and thousands of dollars a case. So we could spend a lot of time negotiating with that group or just say, this isn't who you want to work with. It's going to be really expensive. Or you can go here and it's free. And it's probably a better quality care looking at the volume we have. And I think that is how we make them be more competitive in a high-spirited way. I think cutting I cannot unilaterally cut rates within an Aetna contract. The CPP I can end because that is something the previous administration have done. I think how we get folks to lower rates and higher quality care is to recognize the value of state employees, which I think we can all agree is not happening right now.
Well, no, and jacking their rates up when they're probably not getting a pay raise this year. They certainly don't have one on the table at this point. We don't know if we'll get a budget. That doesn't make them feel appreciated either when they know, because we've been telling them, there are healthcare executives getting 41% raises. Yeah. These healthcare executives reported it, or the entity that hires them reported
the top
that they're top
yeah.
folks, not just 1 or 2 top folks. They're deep with top folks at these hospitals. We're getting 41% raises. State employees are looking, and retirees, at nothing. And their costs are going up. But they don't see the 41% raise people giving anything in this scenario. And I think we're with you that we hope this Lantern program works. But all state employees have still is hope that something changes, and we're not right back here a year from now saying, well, that didn't work either, so we're coming back to y'all again. Because these increased costs on employees would have to be increased again if Lantern doesn't work, right?
No, I think Lantern is going to be the thing that pushes things forward in the next direction. I think we are going to do a lot of different things to make sure we are sustainable through 2027 and 2028 and beyond. We're going to continue to evaluate investing in members' health and looking at other ways to keep folks healthier. I think we have a pathway to retain on that good footing. I think Lantern is going to be exceedingly helpful, but we are not banking on any one thing. I think that would be a little foolish to bank on kind of one strategy. We're kind of looking at are different ways to get people to lower cost imaging that has nothing to do with Lantern. It has lower cost other procedures that have nothing to do with Lantern. And that's through partnering with independent primary care. That's through partnering with independent specialties at reduced copays to members. So again, I think our responsibility as good stewards of the plan is to make it as affordable as possible for our members to see the providers that are committed to working with state health plan members. And I think we've got great footing there for primary care. We've got great footing on there for specialty care. And part of what we're sharing savings with those providers on is by helping us refer to being aware. And I think providers have not done a great job of being aware of cost differences outside of their own practice, giving them and empowering them data at the point of that referral to say, hey, if you go to this ASC for a colonoscopy, and I don't know why I keep picking on colonoscopies.
That's
something we all have to have.
But right,
It's on your mind.
Yeah, they're higher quality, and it's a third of the cost of somewhere else.
And when Thomas says ASC, he means ambulatory
surgery center. Yes, thank you. So we're putting more data out, and we are requiring providers who want to work with us, again, be data-driven, be transparent, focus on quality. Quality is the front door for everything for state employees. We will share in the savings with you, and but before we share in savings with you, we're sharing in savings with our members to get them there as cheap as we can. So I think we'd all agree healthcare is broken, and we're going to continue to make incremental steps forward. But I think the lesson of CPP is if we want our members to change their behavior, we have to help them in their pocketbooks. We have to do it. And so,
see, I think the lesson of CPP was the legislature wouldn't support Treasurer Falwell when he said, I want to incentivize folks who are willing to see employees at a reasonable rate and actually pay them.
Well, there can be more than one lesson, right?
There can be. Yeah. Fair.
Yeah.
So, but you've got the comments. I shouldn't.
Well,
our members'
and we've
comments
covered a lot of information there, but let me break it down and correct me if I'm wrong, just from my conversations with members lately. So there are some concerns that the state health plan will be telling them where they need to go for care now because of the Lantern program. But it may be, if I'm understanding this correctly, that UNC or Atrium, whatever system is in your area, it may already include doctors that you see. So, and even if they're not part of the Lantern program, someone can still make the choice to go see
that's right.
whoever they want
so
to see.
I think about this as more, as many carrots as we can. You can still go see whoever you want to go see in network. That is not changing. How we're going to, we're using Lantern as an incentive for free. We're going to pay for your travel to get to those providers, whether it be miles, whether it be airplane flights, whether it be hotels. Because again, going back to putting you up at the UMSED, it's a better deal for us. I don't think it is fair to start taking away choice from members. I think if we're really, really successful and everyone starts using these providers organically and it's their choice, then we can sort of discuss it at that point in time. But this is something new. And I think so you can go see if your provider is in network now, and there's a Duke conversation to be had as part of this. It's adjacent, but we're not taking anyone out of our network right now. This is a benefit enhancement. Your network is your network as it is today. As long as they agree to be the network, we can talk about Duke.
Point.
Yeah. Thank you for clarifying that. And while we just touched on Duke, a little update on what's happening between Duke and the plan.
Yeah. So Aetna, who is our third party administrator, negotiates a good number of contracts on our behalf. I think the treasurer and I are trying to take more of that internally, so we can own the contract and kind of make our goals around quality and price specific to state employees, use our leverage. So Aetna, as our third party administrator, negotiates with health systems on rates. Right now, and I'm sure all members have received this if you use Duke, that Duke has said if they don't get a rate increase, they are going to go out of network in late October. Gave me a lot of pause when I heard that, obviously, because they're our big in-network provider. I've talked to leadership at Duke every couple of days. I've talked to leadership at Aetna every couple of days. They continue to work on it. I remain optimistic that they are going to get something done that is of benefit for state employees. And I think this is another area where the lantern stuff keeps us on the offensive. So I've articulated to leadership at Duke, if you are not part of our overall network, you will not be part of the Lantern network. It is not one or the other. You don't just get to pick the surgical volume that is most profitable that you can drive margin on. You're either all in or you're not in. And I think that has been an effective negotiating point. And I think it articulates the value of Lantern a little bit. They're like, oh, well, what if we just go this route? I'd be like, no, it's both. It is both or neither. So, but I do remain confident that they are moving in the right direction to get something accomplished beforehand. And we should know who wins the Lantern contracts is going to be announced middle September. So they really have from my point of view, till middle September to figure something out beforehand.
Yeah, it's coming up.
Yeah.
And to be clear, that's the whole Duke network, not just like the places in Raleigh and Durham, right?
No, so the one thing that is exempt from that, is my understanding, is the Lake Norman Hospital.
Okay.
Because that had a separate contract with Aetna that is just on separate time periods, is my understanding.
And the reason I ask is because our local hospital in Sanford is a Duke hospital. So
the Duke Life Point hospitals are different.
Oh, they're different?
Our
Okay.
Sanford moment,
Yeah.
we have at least one.
Yes. They are on a different contract structure.
Oh, okay.
So it is Duke Regional, Duke Raleigh, Duke Health Carey, Duke University, and all the primary and specialty practices in the area.
See, it was a good question, Artis.
I'm telling you, Sanford, it's just, we love you, Sanford.
Okay, so moving right along, because I want to cover some of the questions that I got from folks this week. So touch on non-Medicare eligible retirees and how the premium increases will affect them. And also a question that I've gotten a lot is, when will I know how much my premium is, since it's going to be based on my salary? And I know open enrollment is in October.
Mm-hmm.
I'm assuming at that point is when they will find out the exact amount.
Well, because I don't think folks are going to have their raises in October, November. I think folks who have a sense of what their salary is now, what their benefits loaded salary is, when you think about your life insurance, when you think about that is the number there. So I think that will be a good marker. So when you're in open enrollment, you'll see what kind of bucket you're in, and that will populate for you from there. Obviously, non-Medicare retirees don't have a salary. And it is not based on their pension. It is a kind of flat, regular increase across the board.
Family premiums. Touch on that.
Okay. 2 things to touch on there. So as a matter of policy, I think for a long time, folks have agreed we need to get more children on the plan, and we need to make it more competitive to cover children. So we did that a couple ways. So for our folks in our first 2 salary bands, we've actually reduced premiums to cover your children. And we have then on the family plan made it no different than the employee spouse plan. So you can functionally think of the difference from employee spouse to employee family as no premium difference. Your incrementally cost of covering your kids is going to be included in the plan. So we are trying to get, I think generally speaking, the more kids you have is a good thing for lots and lots of reasons. Generally speaking, they're also a little bit healthier, and we
changes the risk pool.
The risk pool. And so we're going to make that investment to expand and kind of hopefully improve the risk pool over time. And candidly, our family premiums are too high anyway. I don't think anyone would argue that. Yeah. And so this is a first step in how do we make these more competitive over time and make them more affordable over time. And I think that is really the goal and the intent. And I think we will see obviously we're not going to see, everyone is not going to see the fruits of that 1/1/26, but we think, the folks that are just covering their kids, they will see the fruit of that in the beginning. And hopefully as we are able to kind of push the needle more and more, we will make it more and more competitive. And I think, so we got to put our stake in the ground somewhere in terms of what we're trying to accomplish.
All right. That's helpful. Thank you. And this, we just hear it a lot. So I'm just curious what you guys are saying to people when you're getting complaints about Aetna. We are getting so many complaints about claims not being paid. They're automatically, rejected. So I know transition is not easy.
Yeah.
What are you guys saying to folks who are contacting you who are having those kinds of issues?
Well, I think the first thing I'd say is please contact us.
Yeah.
We will make it right for members, but we don't. Candidly, there are a lot of issues within the transition, so we don't know about everyone. And y'all have been great partners alerting us to issues. So when there are issues, don't think twice. Call. because that's how we've corrected a lot of issues with labs and copays and deductibles.
And folks can call us, but they can also call.
Please do call either
guys,
path, right?
And I will go ahead and tell everybody right now, you guys are awesome. You're always accessible and always open to answering the questions as quickly as possible, and we appreciate that. It helps us on this end.
I think the transition continues to be a challenge, and we're not hearing it just from members; we're hearing it from providers as well. And we're going to continue to hold accountable for they got to get this right. Right? It is the state health plan is a specific way of doing things. We are a little different plan than a lot of large plans, right? We listen to our stakeholders more. We listen to our providers more because they're not our members. They also are voters in the state of North Carolina. And that is a little bit different. I think, I try to tell them, if Bank of America, their employees' premiums go up, it's like, what are you going to do?
Mm-hmm.
State employees, they're not afraid to articulate their challenges and issues,
right.
and they shouldn't be, right? Like that's the right thing to do. So we have to be responsive, and improving customer experience is something we need to be focusing on every single day. And I think our team is really committed to it. We are working with Aetna every day. When a problem comes up, that's how we try to fix it. And we are continuing to work with them to get back to, this is what our members expect from a service point of view. This is what our providers expect from a service point of view. They got to continue to keep improving and marching towards that.
Right. All right. I'm going to give you one last question here, and I've gotten it a lot across the weekend, and I don't know how to answer it. Is it legal to charge premiums on the tiered basis, and how is that not discriminatory for employees who have worked all these years and are now making a higher income? They feel like they are being punished. A lot of them have told me I hardly ever go to the doctor, so I don't use the state health plan. Why am I having to pay more to supplement someone making less money? So...
Yeah, and we have gotten that question, and I get it, and I understand it. We are not the first people to do salary-based premiums. It would be considered discriminatory if we charged lower-income people more money, but we are trying to target a percentage of salary, which is, I think, how we're driving that. But we have broad authority to do it from a state point of view, and federally speaking, it is something that is very commonplace right now. And I get that.
I could see where people would ask is if it's legal. It's really not so much a legal question, but I think
that's how I was asked.
Is it a smart thing to do? Because it's kind of pitting, some state employees against other state employees in this scenario, while the 41% fat cats that run hospitals, 41% raise guys, go unscathed so far, and state employees are mad at each other. And some of our biggest pools of vacancies are in professional positions.
Yeah.
And so you already have, especially the universities, struggling to even halfway compete to find people who will take a job with the state in professional positions. And so are you worried that might create more of a problem for those people hiring?
I think it's a fair question and a fair concern, and I try to think about it a couple ways. We're trying to get the standard plan for individual coverage to about right around 1 and some change percent of pay, and the enhanced plan to somewhere around 2% of pay. And I think that is easier to do predict in premium increases, because if your salary doesn't go up, your premium shouldn't go up either, from my point of view. And I think that's Treasurer's point of view as well.
Definitely our people's point of view.
Right. And so I think I'm just kind of going to speak plainly. You're sort of damned if you do, and you make it progressive this way, because otherwise it's regressive, and you're doing a higher percentage of salary to lower paid state employees as well. So I think that the challenge with insurance premium pricing is someone is going to pay more, and that is sort of how insurance risk pooling kind of works, right? If we did a flat increase of, let's call it $50, just pretend that's the number, then we are putting a lot more pressure on our lowest paid state employees, a different amount of pressure than the highest paid state employees. And that wasn't something the treasurer was comfortable with doing. I think he recognized folks on the lower end of the income scale, $20 or $30 means a different amount of money to them.
That's right.
And was trying to be responsive and reflect that. Again, I would not pretend to tell you it is a perfect system, but it is trying to rebalance premiums around a principle around, that 1 to 2% of salary, and help us kind of set, here's how we should be thinking about this going forward. But again, totally recognize it is not perfect. My wife was not terribly happy when she saw how much family premiums were increasing.
You're probably going to hear from some of the agencies, to be honest, because they're having a tough time. Yeah. It's a legitimate problem. As far as the legislature's $150 million contribution, you were wildly complimentary to them, and Treasurer Briner, in his video that we referenced earlier to employees, was wildly complimentary. And in fact, he said especially in light of the shortage of money for things that he referenced because of Hurricane Helene and the obvious stress that puts on the state budget. That kind of made me think back to when Hurricane Floyd happened decades ago. And at that time, the legislature pulled money for Hurricane Floyd relief, a portion of it, from the health plan reserve. And it just that when I heard Treasurer Briner mention, they don't have much money because of Hurricane Helene. So $150 million is really good. That made me bristle a minute. Because I thought, oh goodness, absolutely Hurricane Helene relief had to be front and center for the policymakers, the politicians in this state. Without question, we got to put our state back together. But then after that, it always feels to state employees, and I think it feels that way for good reason, that, okay, so we don't have as much money for things, so we're going to do less for state employees. Do you think $150 million is truly a good contribution?
I think if you look at how much premium the employer contribution has increased the last several years, it's definitely below 5%. So I think about it, this is the most money they have put into the state health plan, and is the highest percentage increase they've put in the state health plan in several years. And I think that is fantastic. I think the second part of that is fantastic, because someone described me yesterday as I'm very unpopular in a popular way. That is kind of universally unpopular. If we had to do premium votes last year that were $100 more per member per month, I'd probably be a little less popular. And I think where we're coming from is we are going to ensure the plan is financially solvent. That would have been, I think, I totally appreciate on the high end how high premium increases are. Another $100 per member per month would have been beyond backbreaking, right? And I am so grateful that while they can't agree on much right now, they agreed on this. And I think that is something to be grateful for, because it took a lot of work from our legislative team of Amy and Colin to make sure everyone knew how important this was to state employees and teachers. And I think it is a testament, given everything going on, given all the challenges, that this was one of the 6 or 7 things they could do and agree on. And so I have no problem saying I'm exceedingly grateful for that. I am not in the state budget office. I am not in the revenue office. I can't tell you exactly how much money there is for everything. But those are the things I'm grateful for.
Okay. What about the COVID money? Because I know at the health plan board meeting, Treasurer Briner really made kind of a strong statement about feeling, and I don't know about whom he was making this reference. I don't know if he meant the former treasurer. I don't know if he meant active advocate groups like us. But he said he was very upset that people had been made to believe the hole in this health plan was caused. And I think he might have even used the word solely by the COVID money not being repaid. And what I'm talking about, y'all, is the federal government sent billions of dollars to the states for expenses directly related to COVID. Well, nothing would be more directly related to COVID for a state than the state's own health plan's COVID expenses. And I think it was $200 million-ish that wasn't ever paid to the health plan. Now, we put a lot of COVID money in a lot of places, but not the most obvious. So I was confused by that statement about how it had become put out there as the only reason. I never heard anyone put it out there. Definitely we and other groups have said that's part of your $500 million hole right there.
So I think the point the treasurer is making is that is best case scenario, which I think we've heard pretty loud and clear that money is not coming our way.
No, that money and that's a bipartisan thing. There was a Democrat who was governor and a legislature controlled by Republicans, and none of the above thought that money needed to. We were told after the first wave of COVID money, we'll get you in the next wave. Nobody made sure that happened, either party.
So I think his point is more best case scenario, we got $200 million. That is one-time money. If you think about the 1.4, you use that $200 million this year, it's $300 million. Then the deficit next year, instead of 1.4, is $1.2 billion. So one-time money can soften something, but it exacerbates the impact of the things you have to do in the future going forward. I think the legislature continues to say if there's money left at the end of the year, TBD, but I don't think that money is coming. So I think his point of view is more
just like the tobacco settlement fund money, none of it ever made it to the health plan. And, any number of things. I'm sure the opioid money won't make it to the health plan.
And maybe the insulin money, you never know.
You don't know.
So we aren't going to kind of run on hopes and dreams. We're going to run on how do you do sustainable improvement? I think sustainable reductions to provider reimbursements.
Is it a hope and dream or is it IOU?
My opinion on that doesn't terribly matter. I think the money is going to come or it's not going to come. And It seems like every indication is it's not. And so we are going to run the health plan on how do we be sustainable, not with one-time, one-off solutions, but kind of sustainable growth and sustainable improvement in reimbursement rates. We have a cost problem at the state health plan. Healthcare costs too much. So the unit cost has cost too much. We have, as a state health plan, invested nothing the past 8 years in helping folks get healthier, looking at different options to do that. So part of the money, the savings we get from Lantern, like I'm not going on a vacation with that money. We are going to invest that money in how do we get our members, help them get healthier, help them get care closer to their home. We're looking at food as medicine programs because getting healthy, nutritious food in a lot of parts of the state either isn't affordable or isn't accessible. So how do we reinvest the savings in improving our members' health? That between cutting unit cost and getting folks healthier, that's how we're going to solve our cost problem. And I think a lot of the revenue, whether it be premiums, whether it be money from legislature, those problems resolve themselves a lot better if we tackle the cost, right? If we need less revenue, if we have less costs. And that is where you're going to see our focus being, whether it be through Lantern, whether it be through kind of different surge programs, is addressing the two-pronged cost problem we have, because that will benefit state employees at the point of care and it will benefit them from a quality of life point of view. But that takes a little bit of time, and that is where we are lasered in on right now. I think you'll see at our November board meeting, how can we further reduce cost sharing for some members to utilize our Lantern providers? Because you have costs before you have surgery. We totally acknowledge that. How do we get those providers, make it easier for members to go see those providers the first time, not just waiting until they have surgery? And that's how we're going to tackle the cost side, right? Is by reducing cost to members. Maybe we get a little less revenue, but we're going to get a lot more cost savings because we're going to drive members to those practices.
Yeah.
So our commitment and what we need to do is tackle the cost problem of healthcare and not just make it about a revenue increase problem in healthcare. Because where we started, I want to kind of circle back to, the General Assembly and our members have done more than providers have to solve that cost problem.
Exactly.
And
I would never suggest you get more from the General Assembly, except I would like the COVID money paid back. But I would never suggest you get more from the General Assembly because that just is leaving less for public services and raises and, and things for retarees.
COLAs.
Mm-hmm. I think it does boil down to the cost. And so y'all have got the bully pulpit.
Yep.
And you're, 8 months into this?
Yeah.
So it's
8 months or 8 years. I can't tell it at this point.
Yeah. And so we all look forward to seeing the things. We know you're all working hard over there. And we thank you again for coming again.
Always
and
have an
volunteering to
exclusive.
come and hear the tough questions from the ones our members had and the ones we still have as staff. I think this is going to be an incredibly difficult thing, but at the end of the day, it's almost impossible to stand up to Goliath in a way that will make a difference. But you've got our support in doing what you need to stand up to Goliath.
And like I said, anywhere y'all need me to be, I will be there in front of members and having the conversation with them.
Sounds
well, that's great because we got convention in a couple of weeks. And just so everybody knows, the State Health Plan and Lantern will be coming to convention, so you'll get more information there. But
keep an open mind to that, y'all.
Yeah, please. Thank you, Thomas.
Thanks, y'all.
Okay, we're back from that interview. It was a great interview with Mr. Friedman.
Mr. Friedman. Always appreciate his accessibility and willingness to have these conversations with us.
He is not scared of tough questions.
No.
Step into the lion's den. And you guys peppered him pretty good with some questions from our members. I'm sure they'll appreciate that.
Yeah. Tried to get some of your concerns answered straight from the horse's mouth, so to speak.
Well, as one of my police officer cousins once said to me, you knew the job was dangerous when you took it.
So one thing I just want to go back to, and it's a very small thing, but I was not courageous enough to ask when he was here. I just didn't think it would fit in the moment. But when he's talking about some procedures costing 7 times what it would to go somewhere else and do it, and he was talking about, I could pick them up in a limo and take them to the place and get it and still be cheaper. How is that legal for a place to charge?
It's the free market. It's whatever you're willing to pay. That's our point. You shouldn't be willing to pay it.
Yeah, but doesn't it kind of venture into the realm of price gouging at some point, though? Like when we have a hurricane, the attorney general gets out and talks about, don't overcharge for gasoline or something like that. There are laws against price gouging, right?
Yeah. I mean, I don't think from a legal standpoint that it would be a neat enough box you could put that in. However, you can certainly put it in this is not right. And the way we keep saying this to people is, look, if this were widgets, it's capitalist society. We're cool with that. Everybody charges what they want to for widgets, and you choose where you want to buy the widgets. Mm-hmm. And so you choose where you shop every day. You choose where you get groceries. And if you think somebody overcharges, you just, I don't go there. They're too much. But with your health care, there's somebody else negotiating that for you if you're a state employee. You're relying on the health plan, the third-party administrator, and the providers.
And people generally aren't thinking when your doctor says, all right, we're going to set you up for an MRI, need to get you checked out, and the doctor's office sets it up. Most people just go wherever they've
Well, of course,
set it
because
up,
you are relying on people to negotiate this for you. So, as I was telling Tom, the treasurer has a huge thing in front of him.
Yeah.
He has to either just watch this continue under him, like it has for decades, and get worse and worse, or he's going to have to take on Goliath.
Yeah.
So, he seems like he's up for a challenge. I will tell you, though, like today, literally, while we were interviewing Tom Friedman, the executive administrator of the health plan, a story came out. This one was in USA Today. A $101,000 knee replacement, why some hospitals charge far more than others. And the way this was presented was the cost of employer health insurance premiums has nearly tripled over the last 25 years for all employers. The main cause, economists say hospital prices. And as you're looking at the article that's attached, it says a new report from Trilliant Health, a healthcare analytics company, shows how much medical services can vary. It gives a knee replacement as an example. Says it can cost as little as $12,870 or as much as $101,527. So that's, a $90,000 difference for one knee replacement. So that's, I think, what Thomas means when he says, look, there are times we could pick you up in a limo and put you up at the nicest place in town. And if you get it from a certain provider, we still would save the health plan tons of money.
Yeah.
And that's crazy.
It really is.
So Treasurer Briner has a huge task before him. Treasurer Falwell tried to take this task on. To be honest, other politicians weren't willing to get in that fight with Treasurer Falwell. The question for Treasurer Briner is, can he do that? Can he get other politicians to be willing to take on healthcare?
And we've gotten a lot of questions, and you brought them up, Suzanne, about what Lantern is going to mean for the employees. Like, is it going to lead to them telling the state health plan telling you where you can have procedures and things like that? I think that we're cautiously optimistic about the program, though. It seems, at least from our...
It's like Artis said, things are changing. The world is different. And if we don't go in some direction to try to realize some types of cost savings, then we're just going to stay stuck
we can't say no to everything. And I get it. What they're trying to do is, because there is this price differential that's insane out there, they're trying to drive people towards the lower cost ones, but not just lower cost. They do seem to be trying to put enough protections in there that you're not just going to somebody who's cheaper.
Yeah, they're well vetted.
Right. They're well qualified, well vetted. They're just willing to do it cheaper because they want the volume.
Yeah.
Yeah.
And that is when capitalism is working beautifully. So we are cautiously optimistic, and we have to play ball on some things.
Yeah.
We just think that's not the 100% answer. You definitely still have to get the rest of those costs down.
Yeah, it doesn't fix the problem that's already there.
It's not the total fix, but it's a good step.
Yeah.
I would kind of question whether that's a good motivator for providers, though. Volume, as to
we have no way of knowing.
You know what I mean?
Never had any motivation because no one has required that their contracts be public. Public dollars, billions of public dollars, billions with a B, that nobody can see. So why would you be motivated in any way?
Yeah. I was just thinking, would you rather do 70 knee replacements for $10,000 each or one for $700,000? You know what I mean? I think...
Well, because I think the goal is you want them to then come back when the shoulder hurts to you.
Use their physical therapy services.
Get comfortable with you.
Yeah.
So we're at a wait and see on the program, but we are supportive and
and they're
hopeful that it'll work.
They're coming to convention to present, so you'll get more information soon.
Yeah. And as always, though, if we see problems, we will call them out, right?
And please call us if you've got questions. We're happy to...
Sam looks like she's trying to say something over here. Are you trying to say something?
No.
Well, then it's time to get to the Gen Z moment, so you can say something.
Woohoo! So since today we were talking all about healthcare and that industry, we are going to be talking about a little bit, based on a quick search from the World Economic Forum, found an article about how Gen Zs are reshaping the healthcare industry.
Tell us.
The top 3 points in this article address that Gen Z are the most tech-savvy generation yet, and we are already using digital tools to manage health and fitness. The generation born between 1997 and 2012 are also the most open-minded about mental health and are more likely to seek help. And healthcare companies that embrace Gen Z's preferences will be better positioned to attract and retain patients in the years to come. So this article was in 2023. However, it does tell us that Gen Z makes up about 20% of the U.S. population and 25% of the global population. However, they are only accounting for about 3.3% of total healthcare spending, primarily because we are probably the youngest and healthiest generation at the moment. But at the same time, it's because we don't seek out the traditional healthcare as much because we are already using tech to essentially track our workouts, track our sleep patterns, as well as tracking like our diet. We take a much more holistic view of health and like to look more at preventative as well as what can I do better in my own personal life so that I don't have to go on medication. And they look at a lot more alternative methods.
I think that's true.
It also says that Gen Zs are 20% more likely than others to talk about their mental health in the workplace. And
I know that's true.
I know that's true. But no, yeah.
Although, here at Scenic, we're all very open.
Yeah.
Yeah.
Seriously, if we feel anxiety, we talk about it.
We do.
Oh,
We
yeah.
do.
We
Don't
try
hold
to
your
be-
feelings in.
Try to be a good group for each other.
Yeah.
Yeah.
You're
But-
probably also more likely to Google your symptoms, right?
No, because we
Okay.
learned doesn't matter what
That
you
was
Google.
such a-
You, according to
That's us.
Google, it doesn't matter what you Google.
You have
You're going to
cancer.
die.
Yeah. Whatever you have cancer.
That's basically what
Yes.
Google says.
It's awful.
But it kind of addresses that these shifting generational preferences challenge today's healthcare model, which is based on treating specific problems when they arise. Meanwhile, we are focused on the future and focused on more wellness, prevention, and outcomes and overall health.
Well, Thomas talked about, how the state health plan is going to want to invest in wellness initiatives. So, maybe this all playing together.
Yeah.
That'll be good. Yeah, for
Sounds
the
like
younger employees,
the
they'll especially
trend.
like that.
Yeah.
So my mind just went down a rabbit hole that I
Oh, God.
discovered recently.
Is it a
So-
Reddit rabbit hole?
Well, yeah, kind of. No, it's Neil deGrasse Tyson. I was watching a video from him, and he said, from the caveman years until the 1800s, the life expectancy of humans increased 3 years, from like
Wow.
30 to 33 or something like that.
Fascinating.
And from then until now, it's been 50 years.
Goodness.
And that's kind of mind blowing, right?
Yeah, it is.
So what do you think, like these Gen Z folks, they're probably planning to live till they're 150, right? Like what does the future hold for them, you know?
No
I'm not
telling.
gonna.
That-
I don't know. I think we've actually started, haven't we, in the U.S.? Our numbers
Regress?
actually came down in the last couple of years.
Possibly.
probably, yeah. So
By a
I will
year.
say, I just don't think a lot of Gen Zs want to
Well-
live that
well, I
long.
think
We're like,
because
I don't want to be
we
here.
made healthcare advances, but now we've made it to where people can't access
Inaccess-
because of cost.
Yeah.
Right.
Yeah.
It's not
Yeah.
accessible, so it doesn't really matter that it exists.
that's true.
Yeah.
I remember there was a Time magazine cover a few years ago that was like, will this baby live to 130?
Right.
You remember that?
Yep.
Because of all the advances in
How many times will this baby have Botox?
but it's but it's like it's a real issue for societies. I'm getting really deep but like people are living longer.
Are you having anxiety? Let's talk about
Yeah, I really am. I mean, I think
Okay.
about these things. I'm going to cry. No.
It wouldn't be the first time someone's cried on this podcast.
That's true.
Fair point.
Okay, well, that was a good topic, and it can splinter into a million
Yeah.
directions, so I will just rein it in right now. And we'll go to our final thing, the question of the week. Play my theme song.
John's wacky weird question of the week.
So this week, we kind of brainstormed, and I think we're going to go with, if time and money were not an object, if it was not an issue, what would be one thing that you would do for yourself, or maybe a trip you would take, or a self-care thing you would do? I think mine, I've always wanted to see all 7 lighthouses in North Carolina. That's kind of lame, right?
Yeah.
But I think I would do that, though.
I don't think
Like,
that's
I'd do like a trip.
If time and money were not an issue at all,
Obviously.
you would go to 7 different places in North Carolina?
I'm just talking about like random things. Like, of course, if time was not an issue and money was not an issue, I would buy like front row seats at season tickets to Carolina basketball. Like, obviously, right? That would be my first purchase. But I was trying to think of something wholesome that I would do. And I've always wanted to do that. So that's just stop it, artist. You cheated.
I'm raining on your dreams.
Well, I think if time and money were not an object, I would take care of my little family first. We would have sort of a compound where we lived. You know, the kids, their own family home, and somewhere on that property, there's going to be a tiny home for GB. And I would just live there and find my joy, which is self-care. Find your joy. I'm the queen of dissociating, so finding actual joy is important. So those babies are my joy, so that's what I would do. But if time and money weren't an object, then I could take them traveling, or, you know, we could experience all kinds of things. So yeah, I just think finding the love. Find the love, y'all.
Okay, so Suzanne would start a cult. Sam, what would you do?
So I do have a dream that I've had since I was like 10, 11. I would take my mom to Italy and Greece.
Nice.
And we would just go on a trip to Italy and Greece. The Italy didn't come about until later. Greece has always been a dream, just to be able to afford to take my mom to Greece.
Again, find the love.
Yeah.
I think eat, pray, love, right? I think that
Right.
Italy enters the conversation for everyone when they start thinking about all the pastas. And I bet I would gain like 30 pounds if I went to Italy.
I actually convinced my mom to read a book. It's called One Italian Summer. I had just finished it whenever I convinced her to read it. And it's a cute little love story, but it's not like your traditional love story. And it talks about a lot about the love between a mother and a daughter and the relationship that can be held there. And it takes place in Italy. And after reading it, my mom was like, you just made me want to go to Italy now. And it's like, it's okay. I wanted to go to Italy too after reading that. So
you should
spaghetti and meatballs
totally
all day long, man.
it's on our list now. Instead of just a week in Greece, a 2-week-long trip one day, and go to Greece and Italy.
I love
Get
that.
that experience.
Yeah. Yeah, I would see the world. That's what I would do.
Yeah.
If time and money were just not a problem, sure.
Yeah.
Absolutely.
You
Go
could
see
do everything
everything.
you wanted to.
Yeah.
You know.
Go see the lighthouses.
Go see the lighthouse.
I would probably start with the lighthouses.
Not the 7 wonders of the world, the 7 lighthouses of North Carolina.
Yeah.
And when we're speaking of the coast a little bit there, you know, we've got this Hurricane Aaron who's causing a little bit of issue here in North Carolina. So y'all be safe. We're thinking of
I saw that it's kind of turning out to sea though, right?
Yeah, I think they're still expecting some.
But I know Highway 12 already had that.
Yeah.
That's what I was going to talk about.
So DOT, y'all be good.
Yeah.
Highway 12. Didn't they rebuild it recently?
They rebuild it all the time.
I mean, but they thought it would withstand a little more. It's a strip of concrete on the
My grandpa
ocean.
used to say, Army Corps of Engineers ain't going to ever outsmart God. So we have to put things back together the best we can, but we have to know that probably going to have to put them together again.
Yeah.
Yeah. And that's why we have capable state employees to do that.
Yes.
Shout out to DOT. Whoop, whoop.
Yeah, I believe Currituck County just had their evacuation notice entered last night saying, like, get out. And they have to drive like 4 miles on the beach just to get to their homes.
Wow.
So
hopefully those people
yes.
get out safe.
Yeah, there were people who live in that area who were posting saying, hey, if you're a visitor here, these are times that tide is high. This is the times that it's best to not leave. And here's the low tide times. This is when you should get off.
Yeah.
Are there any other hurricanes out there? Usually when there's one, there's like 3 others storming.
Yeah,
I've heard that there's
I've
heard that there's another one following after Aaron, but
boom,
just in time
haven't
for
seen
convention,
much.
Right? Just in time for us to be in Greensboro. So.
Yeah.
All right. Well, that was a great show. Thanks for joining us.